Drug overdose deaths are being recorded in a new way here in the Commonwealth. The Virginia Department of Health says the update allows for consistency in drug overdose death reporting. Target 7 investigator Chloe Vincenti joins us now. And Chloe, what is the data showing, and does this update impact our numbers here in Roanoke?
Yeah, Mitch, well, VDH says the entire state is seeing drug overdose deaths decline, including here at Roanoke. The new reporting system may make the decrease here seem a bit more dramatic.
VDH made the decision to use one primary drug overdose data source to publicly report those numbers.
Up until May 12th, VDH used death certificate data from the Drug Overdose Deaths Dashboard and VDH Office of the Chief Medical Examiner death investigation data. The two sources define drug overdose deaths differently, which resulted in inconsistent numbers. According to VDH, the main differences are in the way the overdoses are classified, the residence of the person who overdosed, where the death occurred, and the substances used. Our Target 7 team noticed a steep decline in Roanoke's overdose death rate, so we brought our questions to an injury and violence senior epidemiologist at VDH.
The likelihood of the difference in numbers is indeed based on Virginia residents versus occurrence of the overdose. In 2024, the death investigation data do in fact show 83.4 rate from the death investigation data, whereas that is 58.6 in 2024 for death certificate data, just preliminary though.
And the state is now just using death certificate data to report overdose deaths. That means that going forward, overdose deaths of people living out of state that happen right here in Virginia will not count toward our overdose numbers. And Mitch, VDH says that likely is why we saw such a big difference in those overdose death rates. VDH says in both data sources, they are still seeing a decline in overdose deaths. So there is some truth behind that decline.
All right, Chloe, thank you for that update.